are the reasons for breasts feeling lumpy after having breast augmentation? First thing I would say to people, I always say to anybody who's got breast implants in to check them. Now, if you have breast implants in or not, you should check your breasts, because when you got a breast and you got an implant, so let's not forget there's a breast there. So you have to be aware of lumpiness. And what I normally say to people is, if you've got breast implants in and you've got a lump, or you can feel a lump, you need to seek help from someone, whether that be your GP or whether that be your plastic surgeon. I normally tell my patients it's absolutely fine to come and see us, because often the GP might think, well, there's implants there, could it be an implant? And sometimes we can feel the edge of an implant. So in terms of what would be the reasons for breast feeling lumpy, if it's caused by the implant, which I will talk about, but I would also say you've got to be careful that it's not lumpiness caused by the breast, lumpiness within the breast tissue, which would then potentially need to be investigated, and probably by a different sort of surgeon, a breast surgeon, which would be more of a general surgeon who deals with breast lumps and breast cancers. So the first thing is to identify whether it's the implant or the breast. And sometimes we can identify that and sometimes we can't. So if we're not sure, then that would go down the routes of scanning to have a look at its implant and breast and sort of further delineate it. But stick to the brief, because I'm presuming they're talking about what would be the cause of an implant going lumpy. So I've got an implant here somewhere. Tidy up in here. I don't know where they are. What they were down there. Anyway, okay. Right, not prepared. Don't worry, it's okay. I have got an. Okay. Anyway, if you can imagine an implant, picture it. If an implant's a bit squeezed in, you get what's called a knuckle. You get a little bit that sort of sticks out in the knuckle of an implant. So sometimes you can feel a knuckle of the implant, an edge of the implant. I'm sorry I haven't got one to demonstrate with you, but I think there's been a bit tidy up there, and I think someone's. But anyway, so one reason for a lump would be a knuckle of the implant, the edge of the implant. Being a knuckle, it often feels like a bump. So that's something which can happen straight away, or it can happen over time, because what you get is a capsule forming around the implant, scar tissue forming around the implant, and that scar tissue gradually contracts, and it can make the implant sort of buckle on itself, if that makes sense. So that would be a sort of localized lump. If the implant itself generally feels like a big lump, hardening of the implant is not uncommon with implants. If it's the whole thing that's gone lumpy, then that's capsular contraction, that's scar tissue forming around the implant, making the implant feel hard. Not so much lumpy, but just generally hard. So those would really be the two main things that would be normal for implants to feel lumpy. And nothing to worry about in itself. There are things that can be done about them if you wanted them done, but a lot of times patients want reassurance for lumps. The other more sinister thing that you can get, which might cause lumpiness in implants, would be ALCL, which is a very rare cancer associated with implants. Now, it is extremely rare, and actually the chances of you getting breast cancer, so a cancer within your breast, is significantly more likely, but nevertheless it exists. So that would be a rarer cause for a lumpiness of an implant, and it presents as a lump or a swelling, so spontaneous swelling or a lump on your implant. That is something that might potentially be alarm bells if it's not obviously a knuckle or capsular contracture, and that would be something that would need to be investigated to see whether it was a lump associated with implant, and if that would then need to be biopsied or looked at and taken further. So that is sort of worrying sign. So because of that, because of ALCL, and perhaps more importantly because of breast cancer, if you do have a lump, then you need to get it checked out whether you've got implants in or not.